Hello, my name is Kelly Sharda, RN BSN student at Indiana State University. Today's presentation is entitled Creating a Community Health Program. Community health is important to increase awareness of critical health issues, teach healthy living habits, and provide necessary resources to communities and various populations. Health education is the key to promote health and maintain health and critical to disease prevention. Nurses play an integral role in health education delivery. Understanding a specific population at risk, needs, and preferences will help the nurse to develop a successful community health program. This presentation will provide information for the nurse to use to create a community health program, find evidence-based practices, and also understand funding of community health programs. Community health nurses are the bridge for professional medical care and families and often perform many roles. A healthy community is a strong community, and nurses are essential to providing education and resources to foster health and wellness. Today's learning objectives are: identify 3 health education roles of the community health nurse, name 2 teaching formats, identify 2 organizations to research evidence-based practices, and finally, name 4 health topics to consider for health education. Population at risk, or PAR. The population at risk are community health nurses working with other at-risk populations. Pretest. At this point, you can pause the presentation and use the link provided to complete a pretest before continuing the rest of the presentation. This pretest will give you some questions to test what you already know about creating a community health program. Community health education. Why is community health education important? According to Nisa McEwen, health education empowers individuals to make active choices in healthcare, increase wellness, prevent disease, and acknowledge health potential. Nurses play a vital role in education delivery, creating interventions, and accessing health resources. Community health nurses practice in various roles. Here are a few examples: advocate, caregiver, collaborator, consultant, counselor, educator, research, mediator, and negotiator. It is important to understand the community and the population in which you're working with. Nurses should be aware of the needs, values, preferences, and cultural differences of the community when preparing a health education program. The nurse also needs to be aware of personal beliefs when creating a program and understand any personal bias that might arise for various health topics. Nurses can use different teaching formats. According to Nisa McEwen, various teaching learning formats can be incorporated into your health education program. Teaching formats are ways that the nurse delivers the health information to the community. Here are a few examples: brainstorming sessions, community-wide programs, group discussions, lecture, individual sessions, using role play, talking circles or town hall type meetings, and communities. Health Education Program Framework. When creating a community health program, there are stages the nurse can use to help guide and create the program. The following stages outlined by Nisa McEwen reflect the stages of the nursing process. flow between stages moves back and forth and helps with planning and implementation of the education program. The health education framework contains 4 stages. Stage 1, planning and strategy development. Stage 2, developing and pre-testing concepts, messages, and materials. Stage 3, implementing the program. Stage 4, assessing the effectiveness and then making refinements. Here is a list of community health topics that could be used to create a community health program. These topics were taken from Healthy People 2020. Chronic kidney disease, HIV, mental health, oral health, diabetes, tobacco use, nutrition, sleep health, and physical activity. When creating a community health program, it is important to understand regulatory health policies in which to evaluate and understand the benchmarks you are trying to achieve. Regulatory health policies are used by agencies to model guidelines to implement and evaluate and to monitor public health. Healthy People 2020 is an example of a regulatory health policy. Healthy People 2020 sets objectives and goals of public health in which guidelines can then be created for Americans to reach optimal health. Healthy People 2020 uses evidence-based practices to set benchmarks and monitor progress. Nurses can use databases and websites to find evidence-based research. Examples would be the SINHAL, Healthy People 2020, and the Agency for Healthcare Research and Quality, or AHRQ sites. Nurses should be familiar with finding evidence-based research when preparing a community health program. It is important to educate themselves as well as the community. It is vital that nurses create a lifelong learning model for them to stay abreast of the constant changes in healthcare. Funding for community health programs can be provided by federal funding. In 2010, the federal government approved a Community Health Center Fund to support community health centers with mandatory funding. Expansions to that fund were added in 2015, 2018, and also in 2019. Other funding for community health programs comes from state grants, foundations and organizations, and other third-party systems. It is important for the nurse to understand the program's funding and what available resources are there when developing a program. On this slide, I have additional resources that will help a nurse to create a community health program. It is now time to take the POST test. Click on the link provided and take a POST test to test the knowledge that you have learned in this presentation. In this slide are the references that I used to create this presentation.